Mental illness is a psychological issue described in severe illness, and Alice has Alzheimer's disease, which is one of the dimensions. According to the movie, we can see Alice lost in the street where she overran, and Alice forgot a very complicated word in a speech. Alice began to constantly doubt her ability to remember words, and she suspected that she had a brain tumor. But actually, the confusion about location, time, and memory loss are all signs of Alzheimer's disease. Type of psychological disorder illustrated in Still Alice is neurocognitive disorder. It is a category of condition that often result in diminished mental function. It more often occur in older people, but they can also affect younger people. It can reduce mental function, which include memory issue, behavioral change, language comprehension difficulty, difficulty performing daily tasks and each other. Progressive loss of neurological function cause the brain and nerves to deteriorate over time. According to the movie, the neurocognitive disorder of Alice is Alzheimer's disease. It affects between 60 and 80% of all dementia people. We have 4 diagnoses of Alzheimer's disease. The first one is physical exam and diagnostic test, and the second is the neurological exam, and the third is the mental status test, and the last one is brain imaging. While the symptom of Alzheimer's disease is memory loss, trouble remembering stuff and organizing those, and decrease in the ability to make reasonable decision and judgment in everyday situation. And the last one is about the treatment of Alzheimer's disease. We have 2 treatments, which is drugs and creating a safe and supportive environment. That's all from me. Thank you.
Alice's life was suffering from Alzheimer's disease. Alzheimer's disease was depriving Alice of her identity and ability to act because it deprived her of the capacity to think. Early stage of Alzheimer's disease, Alice had increased forgetfulness, forgetting conversation, forgetting appointments, and trouble remembering names. Alice can take care of herself. Alice could interact more or less normally with others. Forgetfulness is much more frequent and debilitating. Alice faced significant troubles in planning and organizing. Alice still remembers who she is and many important details of her life. However, Alice had to stop her work due to her health issue. This is because her student evaluations were very negative. Middle stage of Alzheimer's disease, increasing difficulty for Alice to perform daily tasks of life. Complicated jobs were out of the question, increasingly confused or forgetting words. Alice had forgotten where objects had been placed. Although Alice had forgotten facts and events in her personal history, however, Alice still remembers who she is. Alice was confused about her location and time for daily tasks. Help may be required. Some people have blunted control problems. For example, Alice cannot remember where the washroom is and she wakes herself. No one with dementia will forget the layout of the house they are familiar with. Final stage of Alzheimer's disease involves an intensification of middle stage symptoms, increased loss of function. Alice often failed to realize what was going on around her and where she is. Her ability to communicate was drastically impaired. Alice began to lose her physical and mental abilities. Alice needed help with all the everyday activities of life. In fact, Alice required for full-time help or 24 hours care. For example, when Anna gave birth to twins, both born, John had to help Alice get dressed to meet Anna. When they arrived at the hospital, Alice had forgotten that Anna was pregnant and asked if Anna was there because she was sick.
Alzheimer's disease really get a huge impact on oneself, on his or her current life, social life, and the daily life. Look at the example of Alice in this movie. Alice lost her job as a professor because her work ability keep on decreasing. And for her social life, Alice refused to social because she felt ashamed and embarrassed to talk with people. In her daily life, Alice changed her behavior and become emotional. She cannot remember everything and even tried to suicide, but fortunately, she's safe. Now look at the aspect of the others people's life. It will impact on others' current life, especially on the family members. Look at the example John in this movie. John is a husband of Alice. John needs to work, but at the same time, he needs to take care of Alice. so it is a big concern for him. But fortunately, all the family members of Alice united together to help each other and also give so much love for Alice in her life. Next, I would like to talk about the factors cause Alice to have Alzheimer's disease. The primary factor cause Alice to have Alzheimer's disease is family history and genetics. A polyprotein E gene, the short form APOE, is a gene that has high risk of Alzheimer's disease on the people. In this movie, Alice's father has Alzheimer's disease symptoms like memory loss when he was alive. So Alice was inherited her father's gene to have Alzheimer's disease, and unfortunately, her doctor Anna also showed a positive result. Tom will show the negative result, while Linda will refuse to check. So to conclude that the factors cause Alice to have Alzheimer's disease is because of the family history and genetics. That's all. Thank you.
The first one is the heuristic theory. This approach is optimistic and focused on the noble human capacity to overcome hardship, pain, and despair. For example, although Alice diagnosed with Alzheimer's disease and she feels very afraid and helpless, but she family show their patience and love to take care of Alice to overcome this hardship. And also her husband accompany and comfort her when she feels helpless and afraid when she know her condition and forget something. And also that she youngest daughter also provide full of the care when her mother lost much of the ability to communicate at the end of the movie. And the second one is the biological theory. According to this particular psychological theory, genes, DNA, and other hereditary factors have an impact on human behavior. In the movie, the Alzheimer's diseases that Alice diagnosed is family genetic diseases from her father. And Alice tells her children that each of them has a 50% risk of having inherited a dominant gene for the diseases. And her old daughter will get these diseases. And the last one is the behavioral theory. The behavioralist theory in professional setting refers to the environment as stimulate and the personal behavior is response. For example, she decided to record a video inside the computer to suicide because for her future she will cannot answer many questions and already unable to talk about her necessity. It is because she knows she will become a person who already lost her memory, experience, and personality that make her not her. So she wants make her life just like butterfly short and beautiful life.
First of all, extrovert. Extrovert personality can be seen in Lydia's characteristic, whereby she is ambitious about her future career path and openness to explore to new things. She could follow up her parents' success in academic and career, but she does not interest. She is more interested in pursuing her dreams in archery. She is willing to accept all the challenges that face during the journey of pursuing her dreams in LA. Other than that, type B personality is also can be seen in Lydia's character, whereby she does not get angry easily. This can be seen when Lydia taking care of Alice who diagnosed in Alzheimer's. She taking care of Alice very patient and she helped Alice to recall back her memories. Even though the questions that asked by Alice are repeating questions, she's still very patient to answer all the questions. Thirdly, neuroticism personality is shown by Alice. Alice become neuroticism and feel very anxiety after she knows that she has suffered in Alzheimer's. She become anxiety in her life because there are many changes. She start to recall everything that she could remember to ensure she forget in future. She even commits suicide with medicine when her conditions is become worse. And she believed that her younger sister Anne, who died in early, is still alive.
The learning can be related to this movie named Still Alice is the operant conditioning. Operant conditioning is a type of associative learning process through which the strength of a behavior is modified by reinforcement or punishment. So, as shown in this picture, there is a successful learning observed in this study. Each member of the pair has an identical board and set of cards. The cards on the director sides with is the right sides are in a predetermined location, while the cards on the mature sides is the left side are placed around the perimeter of the board at the start of each trial. So here are the pictures in the sets of the cards. Next study is carried out by the operant conditioning in older adults with eczema disease. So the present study utilizes a button pressing task to evaluate the extent to which operant conditioning can be demonstrated in older adults with and without probable AD. So findings were somewhat consistent with the expectation that the participant would learn an operant task and exhibit sensitivity to different schedules of reinforcements. At the last part of the movie, Lydia came back from Los Angeles and gave up in chasing her dreams to take care of Alice because John, Alice's husband, have to move to New York for his new job. So Lydia spends her time with Alice and help Alice to recall back her previous memories by answering the question even if it is repeated again and again. So Lydia was very patient in helping Alice even though sometimes Alice have lost her temper.
There are two motivations that found in the movie, which are intrinsic motivation and extrinsic motivation. Intrinsic motivation is the motivation to do something for yourself in order to purely enjoy the task. In the movie Still Alice, the intrinsic motivation shown by the John and the Lydia in the movie is that when John do something for the Alice, the behavior itself is their satisfaction. For example, when Alice's illness was in a fairly advanced stage and was shown to her husband, John could see Alice getting worse and then moved to the Minnesota. He can take her to anyway, give her the best care and continue his own career. He was satisfied with his behavior because he loved Alice very much. Alice's daughter Lydia has always lived in California, and he was moved on to take care of Alice. Extrinsic motivation may be particularly useful when a person needs to complete an unpleasant task. When Alice's memory began to fade and she began to memorize the word, the extrinsic value displayed. For example, she set up a series of personal questions on her mobile phone and answered them every morning. She had the sleeping pills in her room and recorded a video message instructing her future self to overdose to kill himself when unable to answer the question. And her also mobile phone proved the spell memory test, and her laptop concealed a message sent to herself that widely encoded the NSL tearless video tape before falling asleep.